This podcast is being brought to you by Trinity College Dublin. For further information, please visit our website itunes.tcd.ie.
Today, as Suzanne just said, I'm also in Trill, but actually I'm not really going to talk a lot about technology, but I'm actually going to talk a bit more about the process before developing a technology intervention, and that's to actually understand the possibilities where technology could help and really explore the opportunities and also identify the requirements of this technology. And that's actually quite important to do. It's necessary to ensure that the design is actually addressing a problem, that it's actually what people want as well, they want the technology to do, and that it's relevant to everyday living and it fits in people's routines, and also that people can use it. And all of that is necessary for the technology to, in the end, for it to work. But I'm going to start off talking a little bit about technology, just to give just to demonstrate the broad sort of applications that have been developed. I actually got a lot of these from a useful website. I decided to stick it on here because I thought people might be interested in seeing it. It's AT Dementia website, and it's really good because it has a list of various products that you can actually purchase, and it also updates you on research going on. And there's also some question and answer forums. So I just put that on there because I thought some people might be interested in seeing that if they're not aware of it. But I used it to get some of these example technologies, and there's quite a bit out there. There's numerous reminder devices. This example here is a medication reminder that alerts the person when they're due to take their tablets, and a compartment is then revealed so that the person not only takes the medication at the right time, but also takes the correct dosage. And also it stores the medicine as well, so the carer or the practitioner can then look and just check that they're actually taking the medication. Similarly, the other thing on the right there is a locator. And what you do there is you stick various tags onto items that you may often lose around the house. And then you can use that handheld device there to sort of track it down. So it's quite. I could do with one myself actually. So that's just a few examples, some reminder devices. Also orientation. There's various electronic calendars out there to help people remember the day of the week of the month, the times, and everything else. I've used the example actually from the Enable. I think this was used, wasn't it, as one of the many devices used in the Enable project. Right, so I probably will talk maybe a bit about it later, but so there's nice little things like that as well. Also, safety is very important. Monitors for flood detectors and cookers. On the right there is a gas cooker detector, and that was developed at the Bath Institute of Medical Engineering, which is led by engineer Roger Orpwood. And he actually has got you actually attach that to your standard gas cooker, and it will detect when the person has switched the gas on and hasn't lit it, which is actually quite a common problem for people with dementia, and actually is very, very dangerous as well. So that's a great sort of solution there. Similarly, at Buy Me, they have another device which you attach to the door, and it detects if someone's going out at a strange hour. It may indicate that they're wandering or they're confused, and that's actually a little reminder. It's another kind of orientation aid, I suppose. It'll take the day and maybe ask if you want to leave the house. As pervasive computing is developing and artificial intelligence is developing, there's also much more sophisticated work going on as well, looking at how technology can actually track someone as they perform a task and assist them through the task sequence. This is an example here of a very interesting project going on at Newcastle University, and it's led by Professor Patrick Olivier over there. And it's called the Ambient Kitchen, and I think hopefully you can see it. It basically looks like a regular kitchen. there. That's great, thanks. And it looks like a standard regular kitchen, but actually it's embedded with various sensors in the floor, on the counter, in various compartments, and also accelerometers in utensils and various appliances. And that's being used to actually track someone as they perform a cooking task or making a cup of tea in the kitchen. And it can then infer what they're trying to do and identify when they need assistance and provide either audio or ambient cues to assist them through the task. So that's the type of stuff going on, very sophisticated technology. So what I wanted to demonstrate there really was the broad technological opportunities, technological capabilities for applying assistive technology. So I think really a key question is, what do we actually want to help people with? What are the important problems to support, and what should we really focus on? And that's what I decided to look at a few years ago when I was actually doing the PhD at York University. And I was supervised by Professor Andrew Monk there in the psychology department. And what I decided to do was go out and speak with various occupational therapists and other care professionals and get their view of, well, what's important, what should engineers be focusing on and designers be focusing on. And they told me about all the various problems they've experienced and witnessed. And following that, I then went into the homes of persons with dementia and also spoke with them and also their caregivers and asked them what their day-to-day problems or the types of issues they'd like to address. And from those transcripts, what I did is coded what people said. You draw out reoccurring themes, and then by grouping those various codes you can form sort of high-level meaningful categories which can then be grouped again to form high-level themes. And what that does, it provides a very useful summary of my informant's perspectives. And this slide here shows you, firstly I'm going to go through the professional carer perspective. And I won't go into a great deal till here. There's a reference there if you're actually interested in reading more. But what I wanted to focus on was this core theme in the middle. And these are what they, or my informants at least, consider to be the problems to be addressed. And you've got stuff that you would usually expect there. I mean, you've got daily activities, so dressing, toileting, and medication. They also highlight the risks that I mentioned earlier that are currently being addressed. And also other important issues like interpersonal interaction, and that's communication is also important. The other theme up at the top refers to their views on the underlying deficits, the causes of these problems. And I imagine there's plenty of OTs in here who are probably familiar with a lot of the terms used here. So issues of sequencing, also memory and orientation contribute to these problems. And they do also talk about this issue of learning, which I'll come back to as well. And finally, the other theme that emerged was the consequences. And they talk about safety and security and health, which you'd expect. But other things that came out were the person with dementia's sense of achievement. So we should design the technology not just to think about, right, how can we improve their health and independence, but also what activities could we get them to do to increase their sense of achievement. And another thing that came out, which I wasn't expecting at the time but makes sense now, is that they also talk about the consequences for the caregiver. And I think often the technology is directed towards helping the person with dementia, and actually maybe more could be done for the caregiver. And I'll also come back to that as well. So now moving on, that was the professional carer interviews, and now moving on to the patient and caregiver interviews and going into the home. And actually, it sort of reiterated a lot of the stuff that had already come out, as you'd expect. But as I was in their home, a few more subtle issues emerged. For example, domestic activities, even things like locking up, remembering to lock up, or using the television, and other interpersonal issues like using a telephone. So they highlighted some more subtle but equally important issues. But a whole new theme that did emerge, which is interesting, is this issue of situated factors. And this is about aspects of the environment that have a bearing on the person's ability to actually perform tasks in the home. And I think this theme is particularly important for designing technology, because if we understand how the environment either impedes or helps people's ability to perform everyday tasks, that will go to some degree to inform us about designing technology. So I'm just going to talk a little about these. Firstly, verbal cues. People use prompts to obviously help their spouse complete everyday tasks, but they also used other ways of cueing them, such as notes. And this is a nice example here. It's actually a whiteboard which a caregiver used, and she kept it in a prominent location, and it's actually in the kitchen, because when she left the house, even for a very short period of time, her husband would actually become very distressed and not know where she was. So what she did is she put this whiteboard into the kitchen and wrote a message on there, and she just told them where she'd gone and when she'll be back. And that actually worked as a nice reassurance aid, not just for her husband, but also for her, because she could go out and wouldn't feel agitated. And it actually worked. He knew, they set up this procedure where he knew he had to just refer to this whiteboard and it would sort of reassure him. Also, visual cues. I mean, those sort of written cues so it's more explicit, whereas visual cues are more implicit. And some examples there. At the bottom is an image of a husband who put all the items needed to make a cup of tea out on the counter, and just having it all there on display just helped her achieve the task and just simplified it effectively. Similarly, another husband stuck a big yellow sticker onto the vacuum cleaner so his wife could still do the hoovering. It's something she wanted to do, and something he probably wanted her to do as well. I'm sure it's all for very altruistic reasons to do it. So, but it's another example of a salient cue, and these ways you can just simplify the technology. And finally, this issue of familiarity, I just want to talk a bit about as well, because a lot of you will know this, that if it's a new environment, if it's a new appliance, if it's a new routine, it's going to cause problems for the person with dementia. And as I said earlier about the professional carer's perspective, they talk about this issue of learning and the problems of learning. But this problem of novelty is actually a potential problem for designing assistive technologies, because essentially anything that's going to help you is going to have to involve an element of change and an element of novelty. So this is quite an important issue to address, and we need to know what the constraints are on technology. Should it be familiar? Do we need to maintain familiarity? And some people say we do, but that does limit what you can do with the technology. But then going back to some cognitive theory, evidence suggests that if it's intuitive enough, if it's simple enough, then it'll actually bypass the cognitive demands needed for problem solving and reasoning. And that may be one route of introducing new technologies. So I wanted to really answer this question because I felt it's fairly important. So this was another study I did as a spin-off from that. And I decided to use the context of using a cooker to test this question of novelty. And you'll be very familiar with this cooker on the top left. That's your standard design cooker, where you've got 4 burners and then 4 controls in a line. And the way you reference the burner to the control is via these symbolic representations. And it's well known that this obviously will pose a problem for people with dementia, and actually for some of us, I'm sure we've all also made the error waiting for water to boil and it not boiling because it's on the wrong burner. So I felt this was a very good scenario to test this question of novelty. And what we did is we did an experiment where we got, it was actually in a daycare centre where they had a little sort of kitchen set up where people could do various cooking tasks. And I got people with fairly moderate dementia to actually perform these cooking tasks, and actually for the various cooking tasks use these different cooker designs. So the first condition is your standard original design with the symbolic representations. The second condition actually just uses verbal cues, like I talked about earlier. And actually some people did actually at home try and stick on labels to replace symbolic cues, so they don't have to try and recognise them. But that still requires some element of working memory and problem solving. The third condition is the condition that we're most interested in. And this is a completely novel way of cueing the person about how to use the cooker, but very simple. And basically what happens is you put the saucepan on the hob, and then the hob lights up, illuminates like you see there, and the control then starts flashing. And it's a simple association, but very novel at the same time. And then the final condition was actually a control condition. What we did there was just had one burner, one control, and the rest were all covered. And the reason we did that is that people should be able to do that task. If they fail on that condition, then it means they didn't really understand the study. So that was really a control to check they understood what was required of them. So what we did in this experiment is the participants were assisted through various cooking tasks, and the care assistant at hand would actually help them throughout that task. But then at critical points, they were asked to operate the cooker by themselves. And what the care assistant did was they put a saucepan just on the burner and then just said, would you please turn that saucepan on? And then we just wanted to see if they selected the right control and then score them on that basis. And these were the results. So just going to the final control condition, which was using the cover, you can see that people reached ceiling. So they all knew what was required of them in the experiment. Going back to the original design, there's 1 in 4 chance of actually selecting the right control because there's 4 controls, there's 4 burners. So really it was random, they were selecting them at random. In the verbal condition, actually those cues did help to some degree, and you can see an improvement. But you can actually see in the novel condition, using this completely new design, that improvement did also, performance did also improve. So what this suggests is that novelty per se is not necessarily a negative thing and shouldn't be avoided in design. And people do try and focus on this issue of maintaining familiarity in assistive technology, but this would suggest that novelty, shouldn't be avoided. So I just wanted to mention that piece there. But just going back to these summaries of user perspectives, it provides a space for exploring, identifying opportunities for support. And another area I just want to focus in on now, because this is an area we're currently interested in some of our research within Trill, is focusing on the caregiver. As I said earlier, there's lots out there focusing on improving the independence for the person with dementia, but also it does impact the caregiver as well, and they actually play a very important role. So before I move on to telling you about our current work on the Caregiver project, I just want to tell you a little bit about our group within Trill. So we're within the social and mental health strand of Trill. So we really focus on how communication, information and communication technology can be used to reduce risks of loneliness among older adults and also improve mental well-being. And just give you one example of a project we did, which I think is relevant to the Caregiver project we're trying to do, is the Building Bridges project. The Building Bridges project was looking at how we can develop an intuitive interface to reduce risks of loneliness among older people by linking them together. So it's creating a sort of peer support network. That's a picture of it there. It's actually a touch screen computer with speakers and a phone handset. And a core feature in the design of the system is that it provides daily broadcasts. So it's a bit like a radio in that sense. And the user can see, various broadcasts that are due to take place. And if they are interested, they can join. And during that broadcast, while it's playing, I mean, it could be on health, it could be the news, I mean, it could be music, it could be a comedy, it could be anything really. But during that broadcast, they can see who else is listening. There's little icons indicating who else is listening to that broadcast. So there's a sort of shared experience. But then when the broadcast is over, they are then invited to a group chat and they can have a discussion. So the clever thing behind that design feature is that it provides opportunistic interaction. It provides a context for people to meet. It's unobtrusive. People choose to go there. And also because you've got a topic, there's a common ground. There's something to talk about, which is necessary if you're among, initially what are strangers in a group situation. On top of that, the system, there you can see a sort of emailing type messaging system. And also people can initiate their own calls. So as they get to know each other, they can use the system in that way. But the key thing I want to sort of point I want to make here is that this system was developed through a very thorough user-centered design process. And that whole idea of opportunistic interaction and this idea of a radio broadcast actually emerged from the potential users themselves by speaking with them, by understanding the problems of social connections and difficulties in meeting new people. Those were the sort of design features that were emerging. And that's the process we take. And it can be summarised in 4 steps there at the bottom, where you're first going out, doing a little ethnographic work to understand the problem. Then once you start to develop a concept, you go through various iterative stages of testing it, getting feedback, and then finally trialling it in real settings. So we're taking a similar approach to developing a system that could support caregivers of persons with dementia. The project is being led by Joanna McHugh, who unfortunately couldn't make it today. She's at a conference. But we're currently at the very earliest stages. We're actually here, phase 1 of the project. So it's very much an ongoing piece of work. But I'm just going to update you on where we are at the moment. But before I move on, I just want to sort of give a bit of background to the project and why it's important. As you probably all know, dementia is a high priority issue. But also economically, it's very important. In the UK, there was a recent report where they estimated that dementia cost 14 billion in the UK in 2009. But also an important fact I found that came out of that report was that the Informal Caregiver saved £5 billion just from their role as a caregiver. So their role as demographic shift towards an ageing population, the caregiver role is becoming increasingly important. But it's not an easy job, and there's lots of issues and stress related to the role of a caregiver. And a report by Alzheimer's Society Ireland estimated 50,000 people have dementia. There are 50,000 carers of people with dementia in Ireland. The majority report problems with behavioural issues and a disturbance of sleep and physical strain, and a lot also feel very overwhelmed by this role, quite understandably. And all of these factors contribute to their perceived ability to cope. And it's this perceived ability to cope which is the main contributory factor to actually deciding whether the person you live with moves into a more residential-based care setting. So it is actually very important to make the lives of the caregiver easier. So we want to look and understand how information communication technology can do that. A good starting point, though, is to see what's currently out there. And I've just listed a few projects and programs that have looked at how information and communication technology can be developed to support caregivers of persons with dementia. I'm not going to sort of go through each one, but just to give you a general idea of what they do. Most of them are sort of online based, and they have some sort of information provision. You know, they provide some information about dementia care and local services. Some also have more peer support elements to them. So they may have group conference calls like the Building Bridges project I just mentioned, or more sort of questions and answers type forums. And then a few also have more one-to-one, you can consult a specialist and ask them specific questions one-to-one. So it's quite interesting to see what's already out there. But for our project, we want to take a step back. And much like the previous project I was telling you, we want to sort of just explore what the experience of the caregiver is, the experience of their burden, and really focusing on their social connectedness and how that is impacted by dementia. So that's the aim of our current project. And as I said to you, it's very much ongoing. And the current stage we're at the moment is conducting interviews in people's homes. We're focusing on a specific group, actually. We're focusing on spouse, so the husband or wife, person with dementia, who is living with them. And I think we've currently done about 13 interviews at the moment, and we're still going. But these interviews are being transcribed and analysed in the same way as I was explaining earlier, where we identify reoccurring themes in those transcripts. And it's actually done through a very systematic process of analysing this qualitative data. So just to give you an idea of some of the preliminary findings we're having. There are three main themes that have emerged. So on the far right here, that relates quite closely to the data. So they're the sort of codes, that's what people are saying. And then they've been grouped to form meaningful categories, which you'll see listed in the middle. And they're grouped again to form these broader themes. And it's just a useful way, really, of summarising the data. And you just look at it and it captures the perspectives of the people we've spoken to so far. So I thought it'd be useful to just not really go through the whole lot, but just make reference to some of these in relation to opportunities for information and communication technology. So firstly, people talked about education, and that pretty much confirms what a lot of these other systems are doing, which is providing content online. But it's important that it's got to be customised to the individuals and their situation. And dementia is a progressive condition, so it may also be useful to have the content related to that specific stage in that person's life, in that specific situation. But also another thing that came out from some of the transcripts was, people did talk about tips and background information and information about local services. But they also talked a little bit about the need to mind their own well-being. And it's very easy if you're caring for someone else that you could neglect your own health, your own mental well-being. So that's something else that they wanted included in there. So that's kind of informing the design of these types of systems. People also talked about informal supports. So they really valued family and friends who provided practical support, going out doing the shopping, but also emotional support as well, just an opportunity for outlet and sharing your concerns. Although some also had slight concerns about offloading too much onto these informal supports, and they didn't want to sort of affect their existing friendships. If they're talking too much about their day-to-day experiences, they felt it could have ultimately negative consequences. So I'm wondering if, a lot of the peer support type systems in existing technologies focus on advice and kind of knowledge sharing, but I wonder if there's an opportunity there for more kind of emotional support, maybe buddying or something like that. There's that opportunity there, maybe. They also talk about the difficulties leaving the house, and this relates very much to how their social connectedness is influenced by their partner's illness. People have difficulty, they've got to stick to a routine, so they can't just get up and leave. There's also the safety issues as well. They don't want to leave the person on their own. And also difficulties going out together as well, issues of wandering, and particularly in unfamiliar places. So it's an interesting theme itself, but it's also important in terms of thinking about the design of these technologies, because it highlights the unpredictable constraints placed on this user group. And the technology really needs to be compatible with that. People can't necessarily commit to certain group meetings, for example, through information and communication technology. And the other thing it also highlights is not just the sort of time constraints, but also space, places. Current systems that I listed there are all very static. They're either a PC that's an online system, or they're a static video phone, or much like that building bridges device I showed you earlier, which is positioned in a certain location in the house. But maybe something more portable, more mobile, maybe of use. People can do it outside the home, or they may want to go into a private room and use it there. Also, this issue of sustaining social networks. A lot of people felt that there was various reasons why they may lose contact with people. If you've lived with someone for many years, you'll have a shared social network, and they find that their partner may sort of socially withdraw a bit, which has a knock-on effect to them. So there's those issues as well, and some also felt a little bit guilty about just going out and socialising alone. So there is this risk of falling out of their social network and falling out of the loop. So I think the technology should not just focus on instrumental kind of peer support networks and information. It should also look at helping people remain connected with their existing social networks. It should be sociable. It should have a social element. And that's actually quite easy to do. Things like messaging, very lightweight interaction, messaging, photo sharing, will just kind of increase that feeling of presence and awareness, and actually could sort of initiate follow-up contact. So it just keeps people in the loop, and there's various social kind of networking type facilities out there that you could think of that would apply to this. The final theme, which is starting to emerge from the data, is one that I'm particularly interested in. I think it's particularly important, and I think there's not a lot of work that's been done on it. So I think this is a real opportunity space here for technology, and that's to look at how technology can not just help the caregiver's broader social network, but also help relationships. And as you would know, there's communication issues that would occur between the patient and the caregiver. But saying that, a lot had also very positive things to say as well. So you've got things like remote memory. They may not be able to remember day-to-day events, but long-term sort of remote, distant memories are still very much there. And that's, for many people, that's a conversation point, and it's used regularly in reminiscence therapy and things. Other ways as well that people very much enjoyed was sort of that shared experience, just going out for a walk, going out, seeing a scene, going to theatre, going to music. Again, it's not sort of day-to-day event sort of discussion, but it is this sort of shared moment experience. And I think there could be a real opportunity there for technology to sort of facilitate that. And the nearest thing I know of that has done this is the Circa project, which was initiated in Dundee. And Circa stands for Computerized Interactive Reminiscence Conversation Aid. And it was led by Norman Alm. And he's still working on this. But it's actually designed for a care home setting, actually, to support the conversation between the care staff and also the resident. And from their study, they actually, they compared your traditional reminiscence therapy with, photos with this more interactive system. And just to give you an idea of what it does, it's really it contains, it's a touch screen system with various multimedia packages. So it has old photos of local areas, short video captions from old films, old music. And they compared this sort of interactive display with a standard, photographs and that sort of thing for reminiscence therapy. And by analysing the conversation, they actually found that the quality of the conversation was better between the patient and care staff with this system than with the more traditional reminiscence system. I think this sort of interactive element kind of helped that. It's more engaging, more immersive. So I wonder if something like this could be moved more into the home setting. And thinking, improving the social network of the caregiver is important, but this more emotional sort of connection they have with their partner is also important to address. So just in conclusion, in relation to developing information and communication technology for caregivers, I suppose the first point to make is I think it's very important and more work is needed in the area. But on top of that, it needs to include educational content which is customised to the person's needs, needs to be manageable, needs to be relevant, needs to have the general information about local services and dementia, but also help the caregiver reflect on their own well-being as well. The system should also maintain support networks. It should help facilitate links between family members who can provide practical support, make it easy to request help if needed, but also provide emotional support in a way that the person feels comfortable, whether it be with a stranger or a family member. Also, it should be social. I think that's slightly different from social support. It should be fun. It should help people maintain links with their existing social contacts. And as I say, I think this could be done through very lightweight interaction, actually. It needs to be flexible. As I said earlier, it should be portable and should be compatible with these time constraints that are placed on the user. And finally, I think more should be done in the area of supporting the relationship and improving the nature of the conversations between the partners. And the final point I want to make as well, and hopefully I've made this clear throughout the talk, is that the technology needs to have users involved throughout the design process. And that's not just involving them to give feedback or test the technology, but actually going straight back before you even have an intervention in mind and understand the problem and then have the solution grounded in that understanding. That's all I have to say. Thank you.
This podcast was brought to you by Trinity College Dublin. For further information, please visit our website itunes.tcd.ie.